You're 43 years old, you don't smoke. You go to the gym 5 days a week, you eat salads more often than burgers. Your friends call you the healthy one. Then one morning, while climbing a flight of stairs, an unbearable pressure crashes into your chest, you collapse. Hours later, a doctor tells your family he had a heart attack. How is that even possible? If healthy people can have heart attacks too, how do you know you're truly safe? Today, I'll explain exactly why this happens, what is going on inside the heart, and the one thing that could save your life or someone else's. Meet Daniel. He's 43, he exercises regularly, has never smoked, and isn't overweight. Like many people, Daniel believed that because he looked healthy, he couldn't have a heart attack. He was wrong, and by the end of this video, you'll understand exactly why. Most people think the heart pumps blood only to the rest of the body. But here's something many don't realize: the heart is a muscle. And like every muscle in your body, it needs its own oxygen supply to stay alive. Imagine a large tree. The trunk represents your heart. Wrapped around the trunk are thick branches carrying water to keep the tree alive. Those branches are like the coronary arteries. The word coronary actually comes from the Latin word for crown, because these arteries wrap around the heart like a crown. There are 3 major coronary arteries: the left anterior descending artery, the left circumflex artery, and the right coronary artery. Together, they deliver oxygen-rich blood to every part of the heart muscle. As long as blood flows freely, the heart keeps beating. But when one of these arteries becomes blocked, the countdown begins. Many people imagine a heart attack happening suddenly. In reality, it often begins decades earlier. Picture a brand new water pipe. Water flows easily. Now imagine tiny layers of rust building up inside over many years. At first, you don't notice. But little by little, the opening becomes smaller. Something very similar happens inside our arteries. Tiny injuries develop in the artery wall. Cholesterol particles, especially LDL cholesterol, slip underneath the damaged lining. Your immune system rushes in to help. White blood cells called macrophages try to eat the cholesterol. But instead, they become swollen with fat. These are called foam cells. Over time, cholesterol, foam cells, calcium, and scar tissue build into a fatty lump called an atherosclerotic plaque. Here's the scary part. This process usually causes no symptoms. No pain, no warning. You can still run marathons, go to work, play football, or hit the gym every morning. Meanwhile, the plaque keeps growing silently. But I exercise every day. Exercise is one of the best things you can do for your heart. But it doesn't erase every risk. You can still develop plaque if you have high LDL cholesterol, high blood pressure, diabetes, chronic inflammation, poor sleep, smoking, or vaping, chronic stress, or simply inherited genes that increase your risk. Some people are born with a strong family history of early heart disease. Others have cholesterol levels that remain dangerously high despite looking perfectly fit. Looking healthy isn't the same as having healthy arteries. Now let's go back to Daniel. One morning, he's jogging as usual. Inside one of his coronary arteries sits a plaque that has been growing quietly for years. Suddenly, the outer covering of the plaque tears open. Your body mistakes this tear for an injury that's bleeding. So it sends platelets to repair it. A blood clot quickly forms. But instead of helping, the clot completely blocks the artery. No blood, no oxygen, no nutrients. Within minutes, heart muscle cells begin dying. This is called a type 1 myocardial infarction, the classic heart attack caused by a ruptured atherosclerotic plaque and a blood clot. Cardiologists often say, time is muscle. Because every minute the artery remains blocked, more heart muscle dies forever. But not every heart attack happens this way. Meet Sarah. She has severe pneumonia. Her oxygen levels become dangerously low. Her heart is working harder than ever, but there's simply not enough oxygen reaching the heart muscle. Or imagine someone with massive blood loss after an accident. Or someone with severe anemia, or an extremely fast heart rhythm. The heart demands more oxygen than the body can supply. Eventually, heart muscle becomes injured. This is called a type 2 myocardial infarction, instead of a blocked artery. The problem is an imbalance between oxygen supply and oxygen demand. Different cause, same dangerous result. So why does a heart attack feel the way it does? Chest pressure happens because the starving heart muscle releases pain signals. The pain often spreads to the left arm, shoulder, jaw, neck, or back because the heart shares nerve pathways with these areas, confusing the brain about where the pain is coming from. Shortness of breath develops because a weakened heart can't pump blood effectively, causing fluid to back up into the lungs. Cold sweating happens because the body activates its emergency fight or flight response. Some people feel nauseated, others become dizzy. Some simply feel unusually exhausted. Women, older adults, and people with diabetes may experience these less typical symptoms instead of severe chest pain. That's why some heart attacks are missed until it's almost too late. This is where every second matters. If doctors confirm that a blocked coronary artery is causing the heart attack, one of the best treatments is primary percutaneous coronary intervention, or PCI. A cardiologist inserts a thin tube usually through an artery in the wrist or groin and carefully guides it to the blocked coronary artery. A tiny balloon is inflated to push the blockage aside. Then a small metal mesh tube called a stent is left behind to keep the artery open and restore blood flow. The goal is to achieve a door-to-balloon time of 90 minutes or less after arriving at a hospital that can perform PCI. The faster blood flow returns, the more heart muscle can be saved. But if treatment is delayed, the damage becomes permanent. Some survivors develop heart failure because their heart can no longer pump effectively. Others develop dangerous abnormal heart rhythms that may lead to sudden cardiac arrest. Some experience cardiogenic shock, where the damaged heart cannot supply enough blood to the body. This is why a heart attack is always a medical emergency. Let's clear up a few myths. I'm too young. Heart attacks can happen in younger adults, especially when genetics, smoking, or untreated risk factors are involved. I exercise, so I'm protected. Exercise lowers your risk, but it doesn't eliminate it. If the pain goes away, I'm fine. Not always. The artery may still be blocked, or the symptoms may return. It's probably just indigestion. Many people mistake a heart attack for heartburn until it's too late. Never ignore persistent chest pain, especially if it's accompanied by shortness of breath, sweating, nausea, or pain spreading to the arm or jaw. The best way to survive a heart attack is to prevent it from happening in the first place. Know your blood pressure. Know your cholesterol numbers. Control diabetes if you have it. Don't smoke or vape. Exercise regularly. Eat a heart-healthy diet. Sleep well. Manage stress. And if heart disease runs in your family, don't wait until symptoms appear. Talk to your healthcare provider about your risk. Because the healthiest-looking person in the room isn't always the healthiest on the inside. Your arteries tell the real story. If you learned something new today, subscribe for more evidence-based health videos explained in simple language. One video could help you recognize the warning signs that save a life, maybe even your own.